page and review it or share with colleagues who weren't able to join today. So now please join me in welcoming our three speakers. Our first presenter today is Anne Hendricks-Jenkins. Anne is the Capacity Development Director for Health Policy Project. Anne has been focusing on capacity development in global health for nearly 30 years, both as a technical expert as well as a management specialist. Drawing heavily on theories of learning, organizational change, and complex systems, Anne really sees capacity development as an underutilized approach to fostering deep-seated development, deep-seated improvements in health and development. So, Anne, I'll hand off to you.
Okay. I take the
mic. Yeah.
Mic. Okay, this is good. Thank you for the introduction, Sujata, and I'm excited to be here talking about capacity development because obviously it's one of my favorite topics. So I am going to just quickly acknowledge, I'll be mentioning Nepal today in my presentation, and I want to acknowledge the terrible disaster that's happened there and you know, send out my condolences and sympathies and best wishes for getting past the terrible disaster. Okay, now I'm going to talk about capacity development, and one of the key concepts that we're going to consider today in our presentations is the rapidly evolving, in the rapidly evolving world of capacity development is context. So today we're going to consider where capacity development is headed, and we're going to start with a 2-minute backstory, actually, that begins 50 years ago, around the time I was born, so I like to go way back. All right, so these are my grandparents, Drs. Edgar and Elizabeth Miller. 50 years ago, they were living in Nepal as part of a 9-year stint there, and they were physicians. They delivered direct health care to as many as 450 patients a day. And so this was their context in which they worked. It was obviously pretty simple. They had a hospital that was a gift of the king with a palace. There was a king and his court, and there was a group of doctors, and they treated sick people who showed up and pregnant women, and they sometimes towards the end of the 9 years, there was one USAID person in Nepal, and WHO and UN were nascent organizations. There were a few global health and development organizations. They were with one called the United Mission to Nepal. And in terms of private donors, the Rockefellers gave them an X-ray machine, and otherwise they got their funding from churches. So this was the hospital that the king gave them, which was the former palace. And I imagine that in terms of capacity development, if they were thinking about capacity development, which was not really a term then, but for Nepal's health system, it was pretty straightforward because it was not yet the time for thinking about health policy or governance or advocacy or finance. They were focused on service delivery, and so they took the logical next step in capacity development, which was they started a nursing school, and this was the first set of nurses that graduated from the nursing school. So that's the way back story. Now let's jump to where we are today. This is the context that we work in today, and obviously it's far more complex. There are a boatload of stakeholders, and the incentives vary. The actors, you know, civil society, universities, research, private sector, global funds, private donors like the Gates Foundation, global health and development implementers and contractors. It's an extremely complex scenario within which we are trying to focus on capacity development. And then when you add the tools, approaches, and technologies that we use, it gets even more complex. So I imagine my grandparents would be proud of us because we've come a long way, but at the same time, from a capacity development point of view, it's not quite as clear these days how to move forward as it may have been for them. And this is the context, the current context that informs how we frame our work at the Health Policy Project. This is not my grandmother's global health system that she worked in. So the way that we try and operationalize it, we start with how we frame capacity development at HPP. So some of our tenets or principles that we work from are capacity development as something that is happening within a complex adaptive system, and it has to be recognized. We link it to equity and sustainability. We consider it an approach, not an event, not a one-off event. It's much, much more than knowledge transfer, the old biomedical training of nurses, perhaps. It needs to make the most of creative use of technology. Capacity development needs to be stated and intentional. You'll find a lot of people say, yeah, we do capacity development, but it's not stated or intentional. It's just assumed, which we all know what happens when you assume things. And then also it varies a lot by stakeholder and by level. Now that there's so many more levels, including the subnational level, what capacity development looks like to be effectively engaging with all these various stakeholders is pretty, it has to look a lot different in order to be accessible and basically understandable. It's often set at too complex a level for effectiveness. So then we use these principles to determine how we do capacity development at the Health Policy Project. So perhaps in the old days with the nursing school, they used formal education and they used on-the-job training. We still use those, but they're obviously small parts in a much larger portfolio in terms of how we approach capacity development. Facilitated self-assessment, also known as OCA's, Organizational Capacity Assessment, is a complex tool whose name belies its complexity and its value. We do a lot of short-term technical assistance, international technical assistance. We also call that sitting together, and there's a lot that goes on in terms of technical assistance collaboration. We do convening and connecting. We also work with colleague-based learning, which includes coaching, mentoring, seconding, study tours. We have a cohort approach, which I'll say a little bit about more later. Strategic and action planning. Follow-up is often a forgotten approach. We do our great capacity development thing, but then it needs follow-up because it's an ongoing process, not a one-off event, as I said. We sometimes make grants. A really big one is the co-creation of models and tools, and that's where we work in partnership with in-country organizations and stakeholders to take the global knowledge about the topic at hand and create a locally or nationally appropriate tool that really functions within the context efficiently and effectively, rather than just the cookie-cutter approach. We do focus sometimes on digital platforms. We have a great big one in Guatemala that's a great capacity development platform that goes across ministries and helps address turnover. And of course we do workshops and trainings because that's kind of a mainstay. But the point is it's one approach within a much larger set of approaches. Okay, and then that brings me to my final slide, which is what are some of the unique considerations for capacity development that we see within policy and advocacy. And I won't go into these in too much detail because I think that David is going to flesh some of these concepts out a little bit within his larger context. But I will say that in terms of a time frame, sometimes we need a longer time frame for change in results in policy and advocacy. We do achieve quick wins, we achieve medium-term wins, but those need to be part of a longer process, which includes longer-term wins and longer-term change. A continued drive towards equity is an ongoing process, and policy development, implementation, and monitoring is also an ongoing process. So that takes a lot of time, and it takes momentum, and it takes a wide range of savvy stakeholders to keep it all going. For example, we worked in Malawi to institute a family planning line item within the budget, which was a great start and a big win. And the first time it got a pretty small allocation, and now the focus is on the implementation and monitoring of that as the allocation grows every year. We have recognized that substantive policy, advocacy, finance, and governance must be contextualized within that long-term perspective. The second issue that we focus on is the broad range of partners. You know, everybody thinks that their world is the most complicated, but I will say that in policy and advocacy, we have to work with everybody ranging from individual advocates to CSOs, civil society organizations, government staff, high-level officials, representatives from multiple sectors and ministries, including gender, finance, and education, because the best policy work really takes a wide range of stakeholders contributing to it and in terms of the creation and the implementation and the monitoring. So sustaining that engagement and keeping it going with this wide range of partners is part of what I meant by when I said we do a lot of convening and connecting, because those connections that are made and those relationships that are built are a form of capacity that needs to be recognized and fostered. A third implication is oops, my time is up, but I'm almost done, is that individual capacity development has unique facets when you're working in policy and advocacy. Obviously, ideally, capacity development happens within the organizational or system context because individual staff turnover, and we need institutions and systems that can accommodate that reality. However, certain aspects of policy and advocacy count on very specific individuals, including high-level officials and leaders, civil society spokespeople, or even private sector partners. So we're constantly trying to balance that focus on individuals and their role within policy and advocacy while trying to accommodate for sustainable capacity development, because they may move on, and then where will that leave us? We have different ways to address that, including, for example, we work through the convening of networks and cohorts. In Africa, we convene and continue to support dozens of women leaders as a group as time goes on. So that's one example. Then the last thing is, okay, everybody always says this, but measurement is extra hard in capacity development compared to, say, injection technology. And also then you put that in the policy and advocacy context, and it's with the longer time frames. And if you're going to look at performance improvement as a way of trying to get a handle on capacity development with the longer time frame, performance improvement is going to take that much longer to see and to try and capture and to try and link back. And given the complex environments, the attribution or contribution of these kind of interventions is also a tough challenge to address. Okay, so those are my main points. I'm going to turn it over to David, who will talk about a larger context than just the policy and advocacy context, and I look forward to hearing what you have to say.
Thank you, Anne. Before David starts, I just want to do a quick introduction to David. David Jacobstein serves as a democracy specialist in the cross-sectoral programs team of the Center of Excellence on Democracy, Human Rights, and Governance at USAID, where he focuses on the issues of local capacity development and cross-sectoral integration and advancing the agency's local solutions reform initiative. Previously, he worked at PACT in a number of positions, most recently as Senior Program Manager for Governance, and he has supported programs in countries like Nigeria, Kenya, Ukraine, Malawi, and even lived in Mongolia for a year or so. Please note that David is representing a personal and not an official agency perspective.
Thank you, Sujata, and thank you, Anne. That was a really rich lead-off, and I think there's a lot in there. So I'm going to try and I'll pick things up from a different direction, but I'll try and relate them to what you shared, because I think that there's a lot of overlap, and you're exemplifying a lot of what we are saying are some of the future directions for capacity development as the agency sees them. So I'm going to speak mostly to the agency's local systems framework, which is a large policy framework that was produced just over a year ago, and kind of what some of the implications are that we are digesting within the agency for capacity development programming that USAID supports. So the document, which we should be seeing a picture of on your screen, was produced in April of last year and really informed from two directions. One was that this was a response to the ongoing aid effectiveness dialogue and kind of a way to describe for USAID what would it mean to take country ownership seriously, especially with country ownership having become expanded through Busan to be a whole-of-society approach and not just governments, as well as a series of internal changes that were reforms linked together under the rubric of USAID Forward that included, among other things, a desire to engage more directly with in-country partners for USAID mission staff, which is the local solutions initiative that Sujata referenced. And basically the underlying idea in the local systems framework, nothing that earth-shattering, but is simply recognizing and trying to think through the implications of the fact that all of our development outcomes that USAID is interested in supporting depend on multiple interconnected actors. You can't point to a single entity who accomplishes what we think of as the bottom line results of development. And so because of that, this suggests that there is this idea of a local system that is relevant in every country context around the results that we have in mind. This isn't a formal thing. It's really a lens of a system of kind of building up who is it that matters to whatever result it is that a given person in the mission is pursuing. And so the systems framework lays out three ways of kind of taking on board that thought and making that a part of agency work, which are about thinking systemically, working systemically, and aligning our incentives. So I'm just going to go through those very, very briefly. And particularly in terms of aligning incentives, I think the important one for this conversation is to try and broaden the results we seek. So we are always going to be interested in the types of core development outcomes, girls in school, healthier people, people who are able to exercise their rights, et cetera, that are kind of what drives the USAID country strategies in various countries. But recognizing that for those results to be attained, there need to be changes in systems, and then particularly where we are talking about sustainability and having results that will last over time, that there really should be something that we are trying to measure that is about the characteristics of the systems around that result and the likelihood that they will be able to sustain that type of result over time. There's a lot of interesting and ongoing processes trying to think that through, but that's kind of a broad question. In terms of the thinking systemically, at least what this sketches out for agency staff is a way of understanding local systems around this 5 R's framework. There's been a lot of work to look at other things that we can think of, and so this is by no means the best, but it's a fairly straightforward way for people to grasp this idea, is to kind of say, well, there's a certain result I have in mind, and around whatever that result is, whatever that development outcome is, I can think of who are the different actors that matter to it. What are the roles that they play? What are the resources that they're able to draw on? What are the relationships between them? And what are the rules, not only formal things written down in laws and policies, but norms and just ways of behaving that kind of shape how they interact. And together that gives me this bigger picture of a system that's relevant to the result, and I can then speak intentionally to how I would be trying to affect that so that it would be more likely to yield a sustainable result. Importantly, from a systems thinking lens, you would really want to gather multiple perspectives. There should not be agreement on what the system is. It's probably going to be contested. Where you draw those boundaries matters, and so this means that you want to kind of engage with a number of different stakeholders to get perspectives on what is the relevant system, and then also kind of try and describe this rather than viewing it judgmentally. So not going in with a sense of kind of, this is what an education system should look like, and then just describing in terms of, well, this is not where it should be and that's not up to standard, but actually really seeing what's there and only then trying to figure out, okay, so then what do we try and do about it? So pausing on systems thinking because it's in the name and it was one of the things that this was able to introduce. And really this is this idea of complex adaptive systems that for when you get large enough numbers of actors interacting, that it's well-nigh impossible to predict in advance exactly what's going to happen as a result of certain inputs, and that this has some implications for kind of how we think about plans, think about targets and indicators in particular. That something as difficult as sending someone to the moon would still fit in the frame of complicated, because if you've done it once, you can probably follow those steps again and expect to do it again. Something that's truly complex, like raising a child, simply doing the same things you did before is very unlikely to yield the same outcomes with a different child. And so part of the implications of this is credit to Rob Rosigliano, who's an academic from Wisconsin who presented this at a global health meeting on systems thinking, is basically that when you're in a more complex environment, that the success of being able to do something really depends much less on being able to directly deliver things and much more on being able to affect dynamics within the system, being able to learn and adapt, and having integrity in the approach that one is taking. And so I think this kind of very clearly links to capacity development as one of the actions that we are often taking in a complex environment, and has implications for what does that mean for what capacity development means. So that was a very, very short overview of some of what's in the local systems framework, and there's an ongoing community of practice looking at that. There are a number of different offices within the agency that have been dealing with complexity and complex systems for a long time, but really trying to kind of take this down and say, okay, so what does this mean for more organizationally focused kind of capacity development of the type that most USAID sectors engage in? Probably the first couple of points to make are that this means that the capacity of any organization is in some important way dependent on the system around it. So the line that we tend to draw between the entity we're helping and kind of the context that it lives in is a little bit blurry in a way that's probably important to consider. That means that we should probably be looking more at interrelationships and social capital and connections and considering what their implications are for any particular approach to working with a certain group of actors. And it really does change kind of an older paradigm that I would say was kind of supply-driven capacity development, that really capacity development was just something that could be useful to any type of partner. There was always something they could learn. It was always valuable. So while you're doing activity X, Y, Z, whatever it is, toss in a little sprinkle of capacity development and you can expect that that will help things. Probably this is saying, well, no, actually, there are strategic moments and choices that we should be making about whose capacity to invest in, about how to do that, and that really should be driven by how we're seeing the bigger system around them, not by a default sense that kind of, well, this is useful for everyone. So it's a push away from a kind of cookie-cutter approach that says, hey, every organization has a finance department and an HR department, so without knowing anything else about it, I bet I could come in and help them achieve improvements in those two areas and expect that that will yield important results in what they're doing in a bigger sphere. Sometimes that's absolutely true. Sometimes it might not be. And to know whether or not, you would really have to actually see the bigger picture and where they fit into it. And so then this is also credit to Root Change, a small organization that presented this to the agency, kind of a shift among capacity development thinkers that we've been brought on board with, and I think has been validated within the agency largely, is this idea that our basic assumption is shifting from work on the internal nuts and bolts of an organization, work on its management, and then expect that it will get better at whatever it cares to do, to kind of look at how it is relating to a wider system, how it is engaging with others, how ideas are flowing across the system, and then what any organization's desired role is within that. You still might do a lot of the same activities. You still might help it with a lot of the same nuts and bolts skills and functions. But it's a very different way of thinking through the starting point and describing how that is expected to happen. So we have convened to focus on one aspect of this that is often raised as a challenge, is measurement. There is a cross-agency working group on capacity development measurement that's been pulling together some recommendations, kind of from a literature review and as well as conversations both internally and externally, trying to first of all recognize the commonalities in a lot of our capacity development approach across sectors, and then identify what are some of the principles of capacity and capacity development that should affect measurement, and what are some recommendations we can make. This is really centered on organizational capacity. We bit off what we thought we could chew, and that was a starting point that we thought we could take on. And so the deliverable, which we will hopefully later this month be sharing publicly a draft of, are just kind of some recommendations for how any mission or part of the agency that is supporting capacity development programming should think about how it wants to measure it. So I'm going to go through kind of some of the steps fairly quickly and really focus on kind of what are some of our conclusions. So we did do a literature review. I would highly commend this capacity change and performance study that the CDPM did a few years back. Came up with this 5 capabilities model that most EU donors use in evaluations of capacity development. It's also cited this definition from capacity development in practice. I think what we were finding was the commonality across them was that they were drawing attention to capacity as not just the ability to get something done in the short term, to act, to generate results, but also to relate, to adapt, to learn, to be around over the longer term. And that both of those were important. Among the other features that we kind of collectively agreed were true of capacity, it's intangible. You can't go in and count how much capacity something has. You can look at things like relationships and social capital as being quite vital to it, but at the end of the day, it's kind of, you see it expressed more than you actually see it when it exists as potential. As I've been saying, that the wider system really shapes the space, and so you can't really meaningfully understand an organization's capacity without understanding the role it has and how it fits into a bigger system. In terms of shifting from capacity to capacity development, widespread agreement in all the literature that we saw and in all the conversations we had that ownership was really critical. There's a whole literature driven by some scholars who have worked with the World Bank on capability traps, really focusing on the idea that capacity development is about who takes ownership for the change they want to see, and that's really the critical thing that you can spark as an outsider. That there are a variety of approaches that can be used for capacity development, and I would just highlight a few of these that are not what is perhaps typically for USAID a model of kind of from us out, hub and spoke, kind of working with each one, but that there were a lot of potential gains for networking, for creating cohort groups and peer groups and linking people up to help each other where that makes sense to them, rather than it just being something that's driven by the supply of some actor that has something to offer. So then shifting into kind of measurement, kind of the biggest takeaway, the implication is that if capacity is intangible and if it really is different across organizations, then it's a little bit of a fool's errand to be trying to measure capacity as potential before it has been used. And this is the whole capability traps literature is about the challenge of going in to see if they have a really great manual without any sense of its use. From my own personal experience, helping organizations take on board timesheets and then finding out that while they were using that for the grant we were giving them, they weren't using that for other sources of revenue, so they weren't actually using that to manage their people. That's not really capacity development, that's just something that has been imposed. And so as a way of kind of helping with that, not to say that you wouldn't measure some of those input changes because you might expect to see them happen earlier in the process, and not everything can be a lagging indicator, but that really the emphasis of measurement of capacity development should be around performance, because you would expect to see the capacity development lead to performance, and it helps to align our incentives with the assisted organization. Say, look, at the end of the day, we're doing this because we care about how you perform, and that's what we want to come back to and be able to see. That we should be measuring domain holistically. This is one example of a performance index from PACT, but there are several ways of thinking about this. But just basically, again, that when we say we care about an organization's performance, this is both in the short term, how well it gets things done, how efficiently, how effectively, what have you, and then in the longer term, its own role in a bigger system, its ability to leverage relationships, to matter to its stakeholders, to take on board learning and shift its directions and kind of lead. That this would generally be a contribution paradigm, that we would need to have some dialogue with stakeholders around what we should be measuring, as well as what change happened and how we saw it happen. And by definition, for most of the partners we work with, we couldn't expect to attribute everything about how their performance changed to the fact that we've done capacity development, because lots of other things are going on. And that's simply a label of the reality that we're engaged with, not a choice of sorts. And finally, that we should be paying attention to kind of unpredicted change. By definition, capacity is capacity development is investing in an organization's adaptiveness, its resilience, its ability to do well in an unknown future. So if we then only measure how it performed in some narrower space that was what we thought was going to be what they did, we're kind of missing being able to really tell the story of, was that meaningful? Were they able to be nimble, to take advantage of windows of opportunity or recover from negative shocks faster than they otherwise would have? And so our Learning, Evaluation, and Research Office in our Policy Bureau has been putting forward a series of complexity-aware monitoring trials, and there's a whole set of tools up on Learning Lab that you can read more about those. So those would be good examples of ways of doing this. Methods like outcome harvesting or most significant change. But really kind of looking back to try and say something more well-rounded around beyond what we thought would happen and validating whether it did as a result of capacity development, what else is happening that we have contributed to by doing it. And then probably the most important one, the capacity development crowd at USAID gets a fair bit of pushback from people who say, that's always your answer to everything. And I think that's a fair critique. It's not always the right answer to everything, although it comes up commonly, and I would agree with Anne that we probably don't use it strategically as much as we could. But if we are just measuring whether an organization has changed, it's really hard to kind of justify why that was worthwhile. So being able to say that we are measuring something at a wider level, we are trying to measure the system that this entity is a part of in some way and see that its change is having some knock-on effect, is really important to being able to justify when and where that's useful. So measuring capacity development in isolation doesn't seem to us to be hugely useful. And this really is also useful because it allows us to be adaptive ourselves as program managers, go back to our theory of change, and adjust those things as they go. So I'll stop there, and really looking forward to the further conversation around all of this, because I think this is a fascinating area, and we very much recognize inside the agency that a lot of the thought leadership is from all of you who are tuning in today and the rest of our partners who are outside. So really, really looking forward to your feedback as these thoughts translate into recommendations for us to give ourselves.
Great. Thank you, David. So our last speaker today is Helen Kornman. Helen currently serves as the Deputy Director for JSI's AIDS-Free Project. She also is the Senior Technical Advisor for the Capacity Development Center at JSI. In the past, Helen has served as a HIV consultant for organizations such as the World Bank, USAID, and OGAC, among others. She initiated the Prevention Working Group for the Global AIDS Policy Partnership GAP, and also was involved in developing the Capacity Development Network Community of Practice. Helen, I'll hand off to you. Helen is on the phone.
Thanks so much, Sujata. I want to recognize that I co-chair the CD Network with Jennifer Watley from World Learning and Olga Yakimako from PACT. So the CD Network originally initiated as the Capacity Building and Health Roundtable in 2009, and it was rebranded as the Capacity Development Network, the CD Network, in 2012. And the CD Network is essentially a community of practice for implementers and practitioners from a variety of development organizations. It has three main objectives: networking and relationship building, advocacy, and thought leadership. So I was asked to summarize the two presentations today, and as such, I'd like to bring us back to the title of the webinar, Capacity Development and Where is it Heading? I believe there's two key pillars, and those are, in looking at today, measuring performance, and in that, as outlined by David, this must include contribution, not attribution. And when we look at that, we look at determining, as he talked about, determining the size of correlation at any given moment when a donor is trying to ask you to prove the causal pathway, it is important to be clear that our activity contributed to, but in no way was the only factor in the development outcome. That was one really key point that I think David talked about. And then when we look at sustainability, the other key pillar that I think comes out of today, although we've been focusing on measuring performance for the past several years, sustainability, I think, continues to lag behind. And within sustainability, there are several components. We look at sustainability, we look at program sustainability, and within capacity development, we have to look at sustainability of TA mechanisms, sustainability of TA providers, and then within that there are several questions. How long is it appropriate to keep TA operating, and at what level? And as David mentioned, measuring an organization's relevance and sustainability, long-term changes over time is extremely important to the overall health of an organization. This is a really key point. And then when we look at change in the organization and system and organizations are often intertwined in more ways than one. For example, there may be a change at the organizational level, such as gaining legal registration, and yet if there's a hostile enabling environment, such as when we're working in advocacy and policy, like in a country in Uganda that passes a law that bans organizations to work with MSNs, gaining legal registration as an NGO working with key populations may be hindered by that system. Both David and Ann discussed how the landscape has shifted significantly in capacity development in the past several years. However, I also believe there has been a dramatic shift in power dynamics for local NGOs. Under USAID Forward and with other donors, many local NGOs are becoming the primes, and international groups are becoming subs. And this affects them in many ways. For example, there's a large learning curve for local NGOs on USAID rules and regs, managing large procurement processes, developing boards, timesheets, such as David mentioned, sub-granting policies and procedures, etc. Another example is conditional awards are sometimes attached that must be met within a specific time period, and often groups are limited on their ability to provide reliable information, programmatic data, or manage activities if they do not have a supportive enabling environment. Finally, working collectively as NGOs can be more difficult at times than it appears. As Ann mentioned, there is often a large spectrum of partners that you are working with. And there are social power struggles that go back for organizations based on a variety of social factors. For example, stigma between groups, competition between projects, and many other factors that may be hindering groups working with each other. A landscape analysis should be conducted prior to engaging with local groups to understand some of these realities. And also ownership. When we talk about the self-facilitated processes such as the OCAs, these are really key. However, we must give enough time for true ownership and not rely solely on a scoring process, but rather on the action items that come out of the OCAs. And the TA processes, which are the follow-up that Ann also talked about. And we must have sufficient funding for implementation of action plans. Inevitably, this will aid in the sustainability processes and lead to stronger local NGOs. The next meeting that the Capacity Development Network will have will focus solely on sustainability, this question of sustainability, and it's on Wednesday, June 3rd. I know this is a plug, but I'm allowed to do this. Wednesday, June 3rd from 10 to 12. And it will be held at PACT, and it's on the screen here. the address, and we hope to see you all there. And as I said, it's a community of practice where we talk about issues. So we're going to open up the floor now for questions. And as Sujata said in the beginning of the webinar, you can type your questions in, and we'll be taking those in. It's right in the chat function here.
Thanks, Helen. So I've got right now, we've got 3 questions online. And we have a number, sorry, 4 questions, and we have a number of colleagues here as well. So let me just get started with the first question, which is, what are some of the challenges in capacity development measurement?
This is Anne. I'll say that the most obvious one is what you pointed out. When you're trying to measure change within an organization, you have to sort of create some number system and then move around in the number system. It's quite, it can be artificial way to measure an intangible thing. And so it's a challenge because you do need to show results for what you've done. But at the same time, as Helen mentioned, the point of the OCAs that we always say is that even though they're scoring themselves, it's not the score that matters, it's the content, because it's really not a quantitative tool, it's a qualitative tool, although the scoring system helps people keep track. Nevertheless, we always go back to the OCA scores and we hope that they have done better, when in theory they could have done worse because now they know more and they're scoring themselves lower. So we really get ourselves into a circle. I'm hoping you'll solve this problem.
Well, at least one contribution I can let you know is that we are going to have an internal, and we're hoping to port it to be externally available. Also, training on OCA, since there is a standardized version of that type of tool that we've made available through Local Solutions to our officers, and this is probably the critical point that it tries to make, is don't use the scores to measure things. It's meant to yield an action plan, and that's what we care about. But I think that really points to what is the challenge kind of more generally, is that we understand that we are putting some sort of number on something intangible to get an early gauge of progress toward success. But then because we've started to measure it, we flip it around and decide that it's actually going to be signs of whatever that number system is that are what we need to have happen. And so instead of becoming one imperfect indicator of progress toward the change we care about, that in fact replaces our theory of change, and we say getting them up the tree on an OCA score is our purpose because we know that the rest of it will follow. And so part of the purpose of our capacity development measurement group laying out these principles is to say, we know that's not true, so even though you may have some measurement at those lower order levels, don't simplify down to those must be what needs to be accomplished to get to the higher order thing. Keep your incentives linked to the thing you actually care about, and be willing to allow your what you choose to measure as the leading indicators be imperfect, be guesses, and shift as you found out that what you first thought was important turned out not to be. I think that's a much harder thing to do in practice than in theory, but at least hopefully this is a plank in the
Yeah, I think you're exactly right. I mean, I think you're trying to measure towards, you know, your indicator is trying to measure towards some type of development outcome. You're trying to measure towards a health outcome or towards a development outcome, and making that your indicator as opposed to the actual score on an OCA or on some type of assessment score.
This is Dan. I'll add one more thing too, which is that I think part of the nature of this kind of work compared to, you know, the simpler days of yore is that it is complicated, and trying to oversimplify it. I mean, it has its moments where it helps people visualize things, but we've found that even working with some of the most new or basic organizations in rural places, people can understand the complexities of organizations if they are worked with and, you know, exposed to the ideas, and those ideas are able to be related to what they're doing and what they're trying to do. So even though it is complex material, people are capable of grasping it and understanding it and doing something about it, even at the most basic levels. But only if we really take the time to play that out and not try and do some quick and dirty scoring thing, and because we don't have much time, you know, because that really undercuts the whole point of true capacity stuff.
Thank you. I'll read one more question online and then maybe turn it over if there are questions in the room, as we have a number of people here as well. So the second question is, how do you recognize when it would be strategic to build capacity of a grantee or implementing organization? What hallmarks do you look for? How do you know when to build a partner versus when to choose a different one that is more capable? So that's more than one question, but I think along the theme.
Do you want to go first?
Sure. And I think this is an excellent question because it's an issue that I know my colleagues in the DRG sector face all the time when we're working to select partners, and there may only be one or two organizations that are trying to address a difficult issue like fighting corruption or standing up for a marginalized group or something like that. So I think part of it is really just understanding that, what is the wider landscape, and are there a number of entities that could be doing this type of work, or should there be? So really, how essential is the entity to kind of the bigger change that you're trying to see? If I talk to colleagues in a market value chain sector who are working on kind of the value chains for agricultural products, their response is always kind of, why would we try and pick winners? We're going to try and influence the incentives, and then the firms that are making it are going to make it, and the other ones are going to fail. So our investment in capacity development is really never in individual organizations because there are market forces there. So I think you need to know something about, should market forces be applying to the type of organization you're working with or not? Letting a parliamentary committee fail because you wish there was another one is simply not an option. So I think for me, it really goes back to kind of first seeing the bigger picture and what are the roles that are missing, who could play those, what roles are given organizations currently playing, and then kind of saying, okay, so is helping them to do something better going to be a useful way? It probably rarely has a clean answer, but I think at least thinking some of that stuff through is much more useful than kind of have the headaches of trying to get them to manage programming gotten so high that I'm ready to throw my hands up in the air and having a decision to move to somebody else because it just was really frustrating. I mean, again, if I look at some of my colleagues' work with a parliamentary committee or with a constitutional court, that's not an option. It can be pretty frustrating, but if you're trying to make a reform that they're central to, you have to fight through that. There are other things where a much lower threshold, it would be fine to ditch somebody and get somebody who does whatever it is better. So really, it kind of depends on the bigger picture and where they fit.
Yeah. This is Anne. Also, I think we need to be highly sensitive to the idea that we have some objectives that we're trying to meet, and we're going to find organizations that we can get to do our thing, which is not really in the best interest of their growth as an organization over the long term. And in fact, we can waylay them and sidetrack them and then leave them high and dry, having lost their original modes of moving forward because a lot of money showed up. So it's a delicate balancing act, and I think it goes all the way back to the original project design and the understanding of the landscape before the sort of plan is already in place and you're looking for the people to kind of do your work. Helen, did you want to add to that?
No, I'm cognizant we have a lot of questions to get to, so we can move on to the next one, and I'll take the next one.
Thanks, Helen. So I'm going to see if there's any questions in the room, and how's the mic?
Thank you. Thank you for the great presentation, David. Tito Coleman at Futures. You mentioned institutional capacity development and the challenges. And the next layer up that we're dealing with more and more are networks doing similar functions across, and we need to look at how that network working, which are those strong ones or weak ones. As you point out, we don't have the luxury of discarding the ones that are weak because we're investing in institutions that need to prevail and continue producing. And at the same time, even those networks are getting more complex. Like in our child protective services, we may have legal, nutrition, education, all social welfare, etc. types of services all bundled into one network. So it's not just TB clinics doing things regionally. But I'm wondering what experience in your group there's thinking about how to tap into network level measurement and diagnosis and then intervention design. It's a bit of a different game than the institutional one that we've been doing at the ethical level.
Helen, did you want to?
Yeah. Well, I can certainly start with this. First of all, it's a very good question. It's partly why I talked about that. I don't think that enough attention goes into this is in looking at the collaboration and connection between groups. That often we're asked to work with groups and also with networks, and there's a lot of interest right now, particularly in health, in working with networks and regional networks, and particularly around policy and advocacy. And because networks have been the basis in policy and advocacy and doing a lot of the work, and the networks often have a good basis in terms of the work that they've been doing. However, they may be either they have been doing policy and advocacy work, but on the OD side, on the functional side, they may need a lot of TA in terms of having some actual accounting mechanisms and some of the other sort of, to be able to apply for USAID funds, they may need a lot of capacity development. And so it's interesting in terms of how you actually then come in and operate on a CD side. How you're going to sort of set up your capacity development if you're being asked to come in on to provide strict TA on that side, functional capacity development. And so I think it's what's the expectation level, and really setting up what is the expectation in terms of what you're being asked to provide, and also having an understanding of what they really want to get out of it also, because I think sometimes it's not congruent, and if that's not congruent, then I think that there's difficulties there. And I've seen that happen before. And then also I think that in terms of sometimes there's a little competition between networks also. And so understanding the landscape of what I was talking about before also is very important, that one network may not want to work with another network also. But David, you can add to it.
Sure, and I would also agree that it's a really good and challenging question, and so I don't have an easy answer for it. I mean, I know that there's been, we've had presentations of people who have done some great data visualization, working in the space of networks. You can actually be trying to pay deliberate attention to their relationships in useful ways, and there can be insights into ways of helping them through different connections to be drawn and things like that, which I think is quite promising. And for us, a lot of this conversation around how do we characterize and measure systems is kind of overlapping. People sometimes refer to the systems as networks. I think we've got systems in the title because there's a discipline of system thinking that they wanted to draw on. I mean, what I would say is really two things are kind of critical to it. One is to realize that for a network or any wider set of actors like that, that aren't hierarchically connected the way individuals and organization are, the ways of working for them are much more dependent on a lot of different people and kind of choices that they're making, and not kind of rules that hover over them. And so I think this means that a lot more attention has to be paid to kind of the quality of a shared vision among all of them. If they're working, I'm a nutrition advisor and I'm working with you, and then I've got a legal aid advisor over here. we have our backgrounds, we have our stories, we have where we came from. To what extent do we feel that we're part of the same thing? It may not be enough for that simply to be what the network secretariat sees going on. That actually might matter. And as well, the quality of the communications among the different folks within a network. So I think those take on a disproportionate importance compared to what they would within a single organization. But I also think that driving, this is part of why the aid effectiveness is in this question of the local systems framework. It was not just an internal agency decision to launch a reform initiative that drove something like that. There's a really essential humility required to thinking about some of this stuff. And it goes back to something Helen said, that, that there are very real power differences out there. When you're working with a lot of different actors who, compete on some things, cooperate on others, have different motivating factors, and you're coming in from the outside to try and affect what they're doing, I mean, yeah, you can do some things around giving them tools, you can do some things around fostering a shared vision, but at the end of the day, they have a lot more power than in other ways of working, and we're choosing to go with that and not to do something where we can just contract somebody to do some direct service delivery and not have to worry about all these players, because it's only through these networks of people that we can get to certain really profound changes that some of the policy advocacy might work towards. So given that, we are simply in a different situation as outsiders who are providing assistance or funding or whatever we're bringing to the table. And that, I think, for me, is the deepest and most difficult aspect of this change to take on board, is that no matter how well we analyze and how well we think things through, certain changes in a network context across multiple countries are not going to happen as fast as we might wish, because the rate-limiting step is how the power is diffused among them and not how clear our project design for working with them is. And that's a difficult thing for us to get comfortable with, and I think it's important that we start talking about that openly among ourselves and with all the various people who will put expectations on us, because you don't want that to be showing up a few years in as a disappointment. You want that to be something that was up front and part of how projects were designed and part of how expectations were set. That's not an excuse to not move things as quickly as we can, and often by being humble and saying, we are an outsider here and so we have to come help, we can in fact move things faster than if we had jumped in and said, I'm here, I'm going to save the day, let me tell you what needs to happen. But I think we do need to be a little bit more explicit about that than sometimes has been typical in a lot of development programs.
Thank you, everyone. We've reached the end of our hour, and I know there's still questions online. We do have everybody's email addresses, so what we will do is circulate the questions that still have remained unanswered to the panelists, and we'll get back to you that way. And there were a couple of questions I know on the sort of information about the Capacity Development Network, so I'll be sure to follow up with Helen and she can share that information out as well. Thank you all. Special thank you to all three speakers for taking time to share their ideas and things. And thank you to everybody for a very rich discussion as well. Enjoy the rest of the day. Thank you.
Thank you.
Thank you.
Thank you, John.
Thank you.
Rajata, you're such a good boy.
Yeah,
You need to know your day job.
I know, I actually really like that.